A running suture is defined as a kind of suture that is made with a single strand of suture material. It is a simple suture. So, to begin with, we place a first knot in the corner of the incision, and after the first bite, we insert the needle in 90 degrees of the incision and pass through the other side of the skin in the same distance as placed in the contralateral edge to give symmetry. This will be the most common stitch that we use to close incisions. It is important to measure the length of the incision to make sure of not choosing a too longer stitch, then it becomes unrolling. We will advance the wounds in a symmetric fashion using the same 90 degrees in each bite and keeping the same distance and same space and same amount of tissue each time, like a solid machine. You must be asking how much we move along. The best answer is if you keep the same pace and distance on both sides. So I would say that the golden tip here is to be consistent. Doing that, in the end, you have a beautiful and good-looking final skin closure. It is important in this technique to keep the distance between the stitches about 1 to 1.5 centimeters when placing a non-locked suture. It is useful to provide a slight tension on the placed suture loop while the next tissue transition is performed. This prevents the suture from loosening in the tissue when performing any additional sutures. The tension may be provided by the surgeon's hand or by the assistant, not by the needle holder. I would say that a nice tip here is not to pull the loop very hard, so one corner will just touch the other. Pulling hard the skin is just ischemic and can cause bad scarring. To conclude, we give a simple bite in the end, making sure you have enough tension along the incision and it is well closed for sure, and wear our instrument tight in the end. And this is the well-known simple running suture.